I'm pleased to be joined today on Health Beat by Dr. Lynnea Stines, an obstetrician gynecologist with Faith Regional Physician Services, OBGYN in Norfolk. And today we're going to be talking about well woman exams. So Dr. Stines, share with us, if you would, why a well woman exam is so important.
Well, thank you for having me today, Rob. A well woman exam serves to make sure that a patient has received adequate counseling, any lab work is up to date, vaccinations are up to date, and any lab work that needs to be done is done. A well woman exam starts with vitals such as height, weight, and blood pressure. And then the most crucial part comes next, which is taking a complete history. We do things such as your medical history, your surgical history, your obstetrical history, and your gynecologic history, which generally we go over how your periods are doing and any history of abnormal pap smears that you've had. We'll go over your social history, any tobacco use or alcohol use, as well as go over family history and any hereditary conditions that you may have. After we do the complete history, then we move on to the screening part of the exam. Okay. And there we'll talk about things that you may need, such as mammograms, bone mass screening, whether or not you need a pap smear, or any lab work or vaccines that you may be due for.
I see.
What each woman will need at each visit will vary depending on their own personal history and their age and any family history that may contribute to that. Okay. So after we do the history and the screening, then we move on to the physical exam. The physical exam generally constitutes a heart exam, lung exam, abdomen exam. Being that it is a well woman exam, we will talk about potentially doing a breast exam and a pelvic exam. These are not needed necessarily at every well woman exam, but we do discuss whether or not you should have it done. But if there's any concerns or reservations about having those exams done, please just let us know. Lastly, Rob, what I generally like to tell women, if you're going to come in for your yearly well woman exam, treat yourself on the same day, whether that means take an extra lunch break that day so you can enjoy some lunch, get a manicure done, or just order a book to read, just to treat yourself. As women, we need to make sure that we are taking care of ourselves every year, and that includes doing the yearly well woman exam.
Great information, especially the treat yourself part.
That's right.
All right. Thank you so much.
Thank you.
Yeah. And that's Health Beat, brought to you today by Faith Regional Physician Services.